Great job.
Thank you. Just from one event to the next.
Very great job.
It made us look strong.
Good. All right, we are strong.
Right.
Good evening. Welcome to the meeting of the Skokie Village Board for Monday, May the 18th, 2020. Before we begin the meeting, I would like to read just a short preface explaining the method by which this evening's meeting will be conducted. Until further notice, meetings of the Skokie Village Board will be held electronically, with a majority of village officials participating via remote access in order to comply with the state of Illinois stay-at-home order. Members of the public who wish to comment as to an item on the published agenda or to comment during public comments must submit their statement or question in writing to the village manager's office, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may be submitted by email to citizencomments@skokie.org, by mail to the Village of Skokie, Village Manager's Office, 5127 Oakton Street, 60077, or via the village's drop box located by the public entry to Village Hall. This evening, we will begin our meeting with the Pledge of Allegiance led by Village Clerk Pramod Shah.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The meeting will come to order, and the clerk will please call the roll.
Trustee Roberts?
Here.
Trustee Sutker?
Here.
Trustee Ulrich? Trustee Ulrich?
Here.
There we are.
Trustee Bromberg?
Here.
Trustee Klein?
Here.
Trustee Gray Keeler?
Here.
Mayor Van Dusen?
Here we have a quorum. Next item on the agenda is approval of the consent agenda for this evening's meeting. A motion is in order. Trustee Bromberg, seconded by Trustee Sutker. Is there anything on the consent agenda anybody would like to have removed? Trustee Roberts.
Mayor, could you please remove item D on the manager's report about the insurance?
Okay, item D is removed. Is there anything else? If not, call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Greg Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes. We now come to a report of our village manager, John Lockerbie.
Thank you, Mayor Van Dusen. Good evening, everyone. Item A is regarding a COVID-19 update, and I've asked our Health Director, Dr. Catherine Kennard, to join us this evening and provide the latest information regarding the COVID-19 in our community. Dr. Kennard.
Hi, trustees. It's good to see you. Maybe we'll see each other in person one day again before long. Thank you. Good evening, Mayor Van Dusen, trustees, and community members who are watching from home. I'm pleased to be with you tonight to give an update on the current COVID-19 situation in Skokie. Together, we are responding head-on to the challenges we face from the very difficult situation caused by the pandemic. I am so proud of this community, your resilience, your positive outlook, and your willingness to follow all the measures in place to limit the spread of this disease. It is because of your commitment to staying home, especially when you're sick, wearing face coverings in public, and social distancing, that we will soon be able to move into Phase 3 of Governor Pritzker's Restore Illinois plan. As of today, there have been 698 confirmed cases of COVID-19 in the village, which means that they have been diagnosed by a physician and have had a positive test. Of these, 207 are still ill in isolation. 12 people are hospitalized, and 22 residents have unfortunately died. I'm extending our deepest condolences to the families of these individuals who were valued and beloved. Most Skokie residents who've become ill were in fact living in the community. There have been just 30 cases, or about 4% of the total in long-term care facilities. Let me read that again. There have been just 30 cases, or about 4% of the total in long-term care facilities. So I want to emphasize how important it has been that we, all of us together, by our collective action, have prevented area hospitals from being overwhelmed, because many of the 97 Skokie residents who've been hospitalized would have been lost if our hospitals had been overwhelmed. If you look at the daily COVID-19 case count graph, you can see a success story, that we have flattened the curve. The virus is not spreading out of control. However, people are still becoming ill every day, so we can't let up our guard. When we think about who's at risk of severe illness in Skokie, you may not realize how large of a swath of our community that is. 20% of residents of the village are over 65, or about 13,000 people. And many others, including members of the workforce and their families, have underlying health conditions such as high blood pressure, heart disease, respiratory illnesses, and diabetes. But the good news is that we can continue to protect people from infection if we follow social distancing, cover our faces, and wash our hands as we begin to reopen businesses and resume aspects of our normal lives during Phase 3 of Restore Illinois. I also wanted to share with you an overview of the occupations of Skokie residents who become ill with COVID-19. We have this information for 75% of people between age 20 and 65, which is really good for these types of surveys. Some of the individuals included in this graph were not included in this graph were working at home, retired, or did not give us an occupation. Particularly noteworthy, as you can see, is that healthcare workers make up 42% of this group. Most of these individuals have been nurses, but other workers have been affected too, such as receptionists, housekeeping, security, physical therapists, and physicians. The next largest group at 20% is people working in service or food industries, followed by office workers and professionals such as lawyers and accountants, people in construction, manufacturing, childcare, and transportation. I'm showing this graph to emphasize that COVID-19 can affect any of us, and we need to be vigilant with control measures in the workplace. About half of Skokie cases have involved transmission within households, often after workers became ill, and then the virus spread to their family members. I again want to say how pleased I am that we've had terrific cooperation and a very positive response from workplaces in the village. Skokie employers are taking the pandemic seriously and in general striving to protect their workers, especially when they've had cases of COVID-19 in the workplace. So what's on the horizon? Skokie is part of the Northeast region in the Restore Illinois plan. Currently, Illinois is in phase 2, or flattening. And there are several metrics which need to be in place to move to phase 3, or recovery, when we begin reopening businesses with safety measures in place. These metrics can be found at dph.illinois.gov/restore and include having the wide availability of testing, that the test positivity rate is below 20% for 14 days, that 90% of people diagnosed with COVID-19 are interviewed by the local health department within 24 hours and their contacts identified so we can notify them of their exposure and the precautions they need to take, again, without revealing the identity of the person who has COVID-19, and criteria for hospital admissions and surge capacity for COVID-19 illnesses. One measure of interest is that the health department has been able to keep up so far with case interviews and contact tracing, with the unflagging help of the Skokie Medical Reserve Corps volunteers and graduate students from the UIC School of Public Health, but this has been at the expense of all other public health work, such as giving kids immunizations against other communicable diseases or following up on childhood lead poisoning cases, and it's going to be difficult to sustain over the long haul. You may have heard Governor Pritzker today announce plans for the state of Illinois to support our efforts, and I will share additional information on the contact tracing program sponsored by the state of Illinois, which includes human services, by the way, as a crucial component when it becomes available. A final graph I have to share with you shows the Skokie test positivity data. We plan to add this graph to our weekly Tuesday updates. You can see that the number of Skokie residents being tested each week is steadily increasing, and the test positivity has been below 20% for the past 2 weeks. Skokie data is included with the Northeast Illinois region as a whole, which has been in the green for 5 days now. There is an economic development task force underway, which I'm sure we'll hear more about in a minute, in the village to prepare to safely move to phase 3, following guidance from the Illinois Department of Public Health and Centers for Disease Control and Prevention that was recently released. We can anticipate that this virus will be with us for some time to come, at least until there is a vaccine, which could well be by early next year. Many companies around the globe are focused on producing a vaccine that is safe and effective as soon as possible. Until then, the best chance we have is to continue with the measures we have in place. I want to thank, again, Mayor Van Duzen, the Village Board, Mr. Lorge, our Corporation Counsel, Village Manager John Lockerbie, Marketing Director Ann Tennis, Human Services Director Beth Lindley, Village staff, and all of the other department heads for working tirelessly to respond effectively to the pandemic. And, of course, I recognize all of the businesses, residents, schools, library, park district, community organizations, faith-based entities, and healthcare facilities in Skokie for your outpouring of support and commitment to working together to see us all through this to the other side. Thank you, and I'll take any questions that you have. Look over here.
Trustee
too.
Sutker.
Hi, trustee.
Hello. Great job tonight, by the way, on WTTW.
Thank you. We have a great community. It's a strong community, and we're prepared, and I think we're having an effective response.
Thank you. I wanted, a couple of residents have asked me why we don't highlight the recovery rate for COVID-19. I mean, they could do the math, but they think that it's it gives them a lot of hope when they see the recovery, the number of people that have recovered. So I just wanted to put that out there.
Well, I might look at Trustee Roberts, who thought that we should, that cumulative graph was putting it, was being a little discouraging to some people because it was just climbing up. So that's one reason why we didn't have it. But truthfully, another reason is that initially we were calling everyone back to find out when they recovered, but we don't have the capacity to do that now. As we're getting more and more cases and more contacts, we can't follow up to make sure that everybody has fully recovered. But the Illinois Department of Public Health is doing that survey every week. And so they have found that about half of people within a week or two are fully recovered, and that by 28 days, 74% are fully recovered. And so we feel that our data would likely, it was very consistent with that, and so that's why we're not putting that on. But we aren't, in fact, contacting everyone again to make sure that they have fully recovered.
Okay, thank you.
Sure.
Trustee Roberts.
Hi, Dr. Kennard.
Hi, Trustee.
It seems as we're coming to the end, I hope, of phase 2, and hopefully we'll soon be in phase 3. What's on my mind is that testing is so important. I'm reading today that by some estimates, we need as many as a country, 40 to 50 million tests a month, which seems just astronomical to me. But luckily, that's not our issue. We have to take care of Skokie. But what do you feel right now is the needs in Skokie? Do we need more testing capacity? And how can the village help? I know it's going to be driven mostly by the state and by our hospital community. But what role will we have, and do we need more testing facilities in Skokie?
Well, I think I mentioned last time that NTL Laboratories is just coming online, and they're going to be able to do an additional 300 to 400 tests a day for the nasal swab to test for COVID-19. And I'm planning to send out a letter this week to all of the physicians in Skokie to say this resource is available to you. And we still have, of course, North Shore and other area hospitals have come online. And there's another facility called LifeScan that is doing testing as well in the village. So you have a good point. I don't know how many laboratories there are in the village that could potentially do this testing, to be honest, but I think that's something that we could look into and see if we could encourage any that may not already have embraced that technology to begin, because it is, for the long haul, going to be really important. So I will definitely look to find out. I'll check with community development and see if there's any other laboratories that might be within the village, or certainly in neighboring communities.
Or is there any discussion among the federally qualified health centers?
Oh, sure.
We have 3 in Skokie, right?
Yes.
That
Yes,
by possibility, would they be?
Go ahead, finish your question, trustee.
Yeah, would they while they may not have a lab themselves, but would they be a drive-by site, or their office spaces be used for testing purposes at all? Would that be an appropriate or possible help?
Yes. The federally qualified health centers are receiving funding directly so that they can do testing for their patients. And as you know, they serve the most vulnerable citizens, some of them, most vulnerable citizens of Skokie, that is, and the surrounding area, people who don't have health insurance or potentially are on Medicaid. And so that's the plan, is that they will do the testing. And so again, you have a good point that healthcare, one thing that's nice about the NTL laboratory is that they will send the test supplies to the physician's office so they can collect the specimen and send it back. But we do still need to be careful that everyone's collecting the specimen in an appropriate way so that the healthcare providers don't become ill. Definitely, it's an effort that requires a lot of communication. I know that Asian Human Services and was already doing testing. I believe that Erie is coming online with testing at the end of May, beginning of June, at their clinic in Evanston. And then I think you had forwarded that there was information at Heartland, which is near Turning Point. So anyone, and that information is on our website as far as if people do not have a healthcare provider, they can contact those facilities. So, but the intent is for them to provide that service for their own patients. I don't know, John, have you heard from Skokie Hospital? Last we heard they were not at capacity. We haven't talked to them in the last week or two about that, or have you heard?
That's the most current information is they have capacity for additional testing at both their drive-through facility as well as other testing.
Right.
But they do have capacity.
They could do 1,200 tests a day, and when John and I spoke with Dave Rahia, they were doing much less than that. And so I don't believe they've gotten up to that capacity, but we can certainly have a follow-up conversation. So we're trying to direct anyone who has symptoms consistent with COVID-19, cough, loss of taste and smell is also on the list now, shortness of breath, runny nose, to contact them. And that information is on our website. And there's a hotline number people can call. Anybody who has symptoms should get tested. And so I have not heard at this point that there's any lack of availability of testing to anyone. I have not heard from anyone that they wanted to get tested and were not able to do so.
Thank you. Trustee Sutker.
Sorry, I forgot to ask this question around testing to follow up to Randy's, Trustee Roberts, but there's some information on the news about reliability of the test, and I wondered if you could just speak a little bit about that.
My understanding, well, it depends on the test that's being done, but the tests that are being done, the nasal swab, where you have to stick the swab deep into someone's back of their nose, that is a highly reliable test. I know there were some tests that could be done by the person themselves where they were trying to swab inside their nose and so forth, and you can imagine that that would be less accurate. But as far as the tests that are being done by our hospitals and by NTL Laboratory, those are highly accurate. But the thing is to do it when the person has symptoms. So North Shore is not testing anyone who does not have symptoms, because the combination of symptoms plus a positive test means something. Again, this test detects the presence of a virus, but it doesn't mean that the virus is viable. And so when we're getting tests on people who don't have symptoms, that's really muddying the waters as far as what do we tell people, as far as what their potential is to spread the disease and expose others and so forth. So really we're trying to limit the testing to someone with symptoms who also has a positive test.
Okay.
And they're more likely to spread the disease. I know we've heard a lot about asymptomatic people, but I should tell you that the people who are ill are ill. Many of our people who are ill, they are coughing so much they can't talk to me to do an interview over the phone. And so this is not a simple, maybe a milder or maybe a somewhat worse flu. It's not. It's much worse than that. And so I'm concerned about even some of the people who are at home that I'm talking to. So we have to be very careful with this.
Thank you.
Sure.
Thank you, Doctor.
Anybody else?
Great job.
Okay. Thank you. And
Thank
thank you
you.
for your support, really. I think everyone's doing a great job.
Just another item regarding COVID-19. Tomorrow is the second meeting of Skokie's Economic Recovery Task Force. Again, there's representatives of the business community on that task force, as well as our local hospital. And Matt Brandmeier, our Director of Community Development, is leading that task force. And so we look forward to that group's work. The village also continues to strategize on how we will be able to open up our services even further once we progress into the next phase of COVID. And so I'm pleased to report that sneeze guards have been installed at all of the transactional counters at the Village Hall in preparation of one day being able to open up the Village Hall. And of course, we will be looking to require masks or face coverings to be used by patrons and village employees. In addition, the village continues to participate in weekly calls with the governor. The village also is actively involved with the Northwest Municipal Conference in representing feedback and our interests as the governor continues to refine the Restore Illinois plan. And then also, since Thursday of this past week, we did have the rain event, and I should say rain events. And so over those several day period, we received 7.3 inches of rain. And the system did become surcharged, and so the regional MWRD system's capacity was exceeded, and so we are working with homeowners and businesses that experienced issues in order to review those, and there is significant information on the village's website that is intended to be helpful for individuals. So if someone did have issues and they want to review those with the village, Public Works and Engineering is working through those with individuals. Items B and C were approved under tonight's consent agenda. Item D was removed from the consent agenda and is regarding the fiscal year 2021 commercial property coverage renewal, affiliated FM insurance for the price of $85,567. The Village of Skokie purchases commercial property coverage through Arthur J. Gallagher, affiliate FM insurance, which expires on June 1st of this year. The all-risk property coverage includes replacement value of all village-owned buildings and contents, market value of the village fleet, and business interruption of 3 malls within our community. Relative to the renewal market, the global insurance industry has had record-setting losses, resulting in a hardened commercial market over the last 24 months. This resulted in significant premium increases across industry. Insurable values increased 18.3% to $101 million over the prior 3-year period. Affiliate FM has quoted a renewal premium of $85,567 for all risk property coverage from June 1st, 2020 to June 1st of 2021. I concur with staff's recommendation that a contract be awarded to Affiliate FM Insurance in the amount of $85,567. Mayor and board approval is respectfully requested.
Yeah.
And Deborah Pratzman is our risk manager, and once there's a motion, she's happy to respond to any questions.
Thank you. Motion is in order. Trustee Klein, seconded by Trustee Gray Keeler. Trustee Roberts.
Thank you, Mayor. John, what caught my eye was the provision for business interruption coverage at our 3 malls, and I guess my basic question is, that's in our current policy, I'm assuming, and then how does that work, and what possible, maybe it's premature at this point, but how would that come into play with current conditions?
A good question. And so many years ago, the village secured that coverage as part of our property insurance. And very important in catastrophic situations to have that business interruption coverage for our 3 significant malls in town. And the way that insurance works is very difficult and challenging in that sometimes it takes a year to demonstrate the loss that occurs. And so we have started the process with our insurance carrier to document what the COVID-19 pandemic has meant for us as it relates to those 3 facilities, but it is a process that we have just started, and so as it unfolds, there will be more information forthcoming.
If I can add, I think it's appropriate to say that Deb and I have been focused on this. There have been extensive conversations, and I have reached out to a law firm to advise us in a broader way, a law firm that only deals with issues of insurance coverage on behalf of businesses. and we'll be getting some of their overview on the issue. So we're engaged.
The courts are going to be kept busy. There will be no shortage of business for the courts, I think, over the next couple of years or longer. Deborah, did you have, I thought I saw you raise your hand.
I have nothing further to contribute other than, yes, this is something that we've started. As you can imagine, it's an area that many other entities and private businesses have made inquiries and claims, and it's certainly a great area of concern for carriers. So yes, I agree with the mayor. There will be a lot of review and potential litigation down the road. So just as it relates to the industry in general. So we're exploring it, and we're looking at what our options are as it relates to the current policy that goes through the end of May, and then certainly the renewal policy that's in front of you moving forward into next year.
The clerk will call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich, Trustee Ulrich, yeah.
Aye.
Trustee
I don't know why it's
Bromberg,
not- Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes.
And that completes my report this evening.
Thank you. Next item is report of our corporation counsel, Michael Lorge.
Thank you, Mayor. Good evening, everyone. Items A and B on my report tonight were approved as part of the consent agenda at the beginning of this evening's meeting. Item C is an ordinance on the agenda for first reading tonight. This ordinance will correct an error in the village ordinance number 20-3-F-4508 that was adopted March 2nd, 2020. And it was an ordinance to reduce the tax levy for the fiscal year May 1, 2019 to April 30, 2020 in the amount of $5,240,720.75. Subsequent to the adoption of that ordinance, an error in the amount of $5,867.50 was determined. The County of Cook has been advised of the correct amount, and it has requested that a correction be made by way of a formal ordinance, which is the purpose of this matter before you tonight. The correction and accurate amount is $5,246,588.25. Mayor, this matter will be back on our agenda on June 1st, 2020 for a second reading and adoption unless there are any questions at this time.
Being none,
The item D on my report for tonight is a request for an executive session in accordance with paragraph 2C11 of the Illinois Open Meetings Act pertaining to the review and discussion of pending litigation. I would request board action.
a motion is in order. Trustee Roberts, seconded by Trustee Gray Keeler. Call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes.
Mayor, that would conclude my report for this evening.
Thank you. The concluding item this evening is citizen comments. Before I turn to John, for those, I would like to advise everybody that there will be a Memorial Day ceremony. It will be done virtually Fire Chief Jeff Hoflick is making the arrangements at this time. Notice has been posted on the village's website. It will be next Monday, May 25th at 11 o'clock. Please go to the website. It will give you advice on how to get to the link for the virtual ceremony. The chief is in the process of making the final arrangements, and we will make those announcements sometime in the next couple of days. John?
Thank you. Two residents provided citizen comments for this evening. One is from Jerry Brozick, and he commented, no need to read this lengthy submission aloud. And so both of the resident comments have been submitted to the village board in advance of this evening's meeting. The second individual was Mary Habish of 5223 Coyle Avenue. And she says, hello, I am an angry and frustrated resident. My home has flooded twice this weekend due to sewage backup from your streets. Obviously, the sewer systems on these two streets need to be updated. Skokie sewage system is old. You have the funds and infrastructure. My flood control system cannot keep up with all the water from Latrobe Avenue. This street is a river, at least 1 foot. I am frustrated because and thinking of taking legal action against the village. I will be talking to my neighbors and collecting their concerns. I am sure they will have many. I hope the village will take my complaint seriously. I am tired of cleaning my property and paying the costs for it. I have reached out to her and will be working with her individually. And those are all the citizen comments that we have this evening.
Thank you. A motion to adjourn, Trustee Roberts.
Mayor, I make a motion to adjourn to executive session.
We are adjourning to executive session. Thank you.